Well, I'm here in Rancho Mirage at Walsh Urology, joined by the man himself, Dr. Lance Walsh. How are you?
Hey, very good, Brian. Good to see you.
Me too. Yes, I'm happy to be here. Thanks for having us. We're in your amazing office. I got some questions for you.
Yes, sir.
So tell me, as far as your clinic goes, what makes you so unique? Let's start with that.
Well, our practice was designed with the patient in mind. From the facilities, we designed a facility that has good patient flow and that has, for instance, the procedure rooms, we play music, we have artwork on the ceiling, and from the staff, patients are greeted with a warm, friendly smile. Patient care is the top priority. And the equipment, we invest into state-of-the-art digital cameras and equipment that is the top in the industry.
So paint me a picture as far as your premier patient service goes.
Yeah, we were recently featured in the Urology magazine for our premier patient experience. And of course, this is a magazine that's read throughout the United States and given to urologists. And we were picked as providing that premier patient experience for patients.
Wow.
And so it was a huge benefit to our practice and also our patients. But it is a process of how we take care of the patient from the time they enter the building until the time they leave.
Yeah, just walking inside of the building, the people your staff's extremely friendly, but there is a very pleasant feel about your office. Definitely can say that. So give me some examples as far as technology that you might use to enhance an experience.
Now, for instance, it's very common in urology to have to do a cystoscopy where a scope is inserted through the urethra of the bladder. It's used for diagnostics. We also use it in terms of a treatment for BPH, which is an enlarged prostate. Treatment's called the UroLift, and we offer that treatment in the office. We use a digital cystoscope that magnifies it tenfold, and so the patient can actually look on the monitor as we're doing the diagnostic procedure.
Oh, wow. That definitely is being part of the experience.
Right.
Okay, all right. So what are some of the minimally invasive procedures that you offer here?
So in addition to the UroLift, we also do vasectomies. We do prostate biopsies, cystoscopies, and some minor bladder procedures in the office as well.
Okay, all right. So is creating a premier patient experience new? Is this something new for you? Is this something that other folks do?
Well, I mean, really the fundamental of why a patient sees a doctor is they want the correct diagnosis and the correct treatment, but it has to be well executed.
Yeah.
And we accomplish all three objectives, and we paid additional specific attention to making sure that we look at the process, what the patient has to go through. You know, urology is no fun. You know, people go to see the urologist, there's some kind of procedure, maybe discomfort involved. So we take a lot of steps to make sure that people have the most comfortable experience in a relaxed setting.
You definitely have done that. We're relaxed. I'm ready to pull out a toothbrush and just call this home. So what are some of the new ways you've designed your state-of-the-art office, for example?
So, one, it's attention to the waiting room. We offer refreshments in the waiting room. We have trained staff to greet the patients with a smile in terms of customer service. We are attentive to the patient throughout their experience, so if they have a procedure, there's always going to be a staff member with them during the time that they're in the office. And then communication. In medicine, communication is key, and from the provider level to our staff and assistants, we make sure we answer the patient's questions to their satisfaction.
All right, great answer. All right, folks, well, this is the place to come. You want to come see Dr. Lance Walsh. I really appreciate you taking the time to talk with us today.
Thanks a lot, Brian.
My pleasure. And thank you. We'll see you after the break.